A debate is brewing over COVID-19 booster shots. Specifically, should Americans get a modified booster shot this fall, and how best to update the shot to fight a virus that's expected to mutate again? News4Jax reporter Eric Avanier is joining us live to explain the concern and what's being done here locally ahead of the fall season. Eric?
Yeah, well, right now, the FDA advisors are asking multiple questions, such as, should the fall season booster be the same shot used to combat the original version of COVID? Should it be a version that was updated to handle the Omicron variant of COVID? Or should they just wait until a new variant emerges and then update that vaccine for that version of COVID? Well, right now in Jacksonville, research is currently underway to help answer those questions. While COVID-19 is no longer a mainstream conversation thanks to vaccines that have saved millions of lives across the U.S., the virus still exists. And because COVID is still around, there continues to be a need for booster shots for people who took the vaccine, especially this fall when scientists predict the virus may once again mutate. And this, of course, leads to mixed reactions about having to take another shot.
The first shot, that's supposed to have been a booster itself. So another booster shot, what level is that going to take us to? Is it really working? Is it really effective?
I have no problem with any of the boosters. I'm fully boosted, and I would take a booster in the fall.
It should be good for everybody. I think I'm going to need me one.
I will take it no matter what, because I believe that it will actually help with the COVID variants. No matter if it doesn't work or if it does work, it'll still help with those symptoms.
Here at the Jacksonville Center for Clinical Research, Dr. Michael Koren says the current COVID variants are different from the variants discovered 3 months ago, which are also different from the variants 6 months ago. This leads to the debate over how to manage an appropriate vaccine for the fall.
So the things that we know is that if you do more frequent boosters, that helps. And we're actually studying right now to see whether or not we should be using specific variant-type vaccines versus just the wild type, or combining the two.
The combination vaccine that Dr. Koren is referring to is called bivalent shots by Pfizer and Moderna, which are currently undergoing trials in Jacksonville.
So you're going to go in for the next 7 days.
Well, we've had a number of patients that are already participating, and we anticipate more studies in the future.
Now, Dr. Koren went on to say that he thinks that we will soon see new vaccines develop from what worked against the original version of COVID, as well as what will work against variants that could emerge. Now, he also says the latest technology will allow them to quickly develop those vaccines. Reporting live, Eric Avanier, Channel 4, the local station.